Next
Remember
Monday?
when Dave used to
Yeah,
use
for
computer
Sarah
off
and me.
the desk?
Yeah, I had the email,
And
but
his
I
name
wasn't
thing,
sure
and he
whether
has to
you
slam it.
wanted it to be Monday of this week or Monday of next week.
Monday of next week, since Monday of this week is gone. And I sent it yesterday.
Monday this week, Sonny, so
There's a lot of things I've missed this week, and that's only one of them.
Monday, next
do it
week,
yet?
Sonny.
I
We
didn't
got to
write
get
up
it
my per
done.
diems for the month.
Well, unless you know someone on the finance
No, right?
committee, you're not going to get paid.
Chris said there's some petitions
Well,
signed too.
That's all right.
I tell you, with the little red hand stick straight up,
All right,
we're
4,
good.
3, 2, 1.
Okay.
All right.
Good evening, everyone. Welcome to the December meeting of the Grand Traverse County Public Health and Safety Committee. I'd like to start tonight. We'll rise and we'll have a moment of silence for the 14 individuals that were shot by a gunman today at a public health facility in San Bernardino, California. Following that, we will have the Pledge of Allegiance, please. Amen. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Sarah, will you call the roll, please?
Lathrop,
Here.
Max Bauer,
Here.
Propa,
Here.
Klaus,
Here.
Crawford,
Here.
Johnson,
Here.
Wheelock.
Yes, ma'am. We're all present. The next order of business will be the approval of the November 4th regular session minutes. Are there any questions on the minutes? And they will stand approved as provided. The first opportunity for public comment. We will take public comment at this point. We'll take it later in the meeting, at the end of the meeting, and we will take public comment during the course of discussion of particular agenda items. Sarah, if you will, please.
Any person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provision of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4, Order of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
Having heard the rules, is there anyone wishing to make public comment at this time? Please come to the microphone.
Georgia Durga, Director, Grand Traverse County Commission on Aging. And I'm here just to give you a quick update. We forwarded a letter to our Commission on Aging Board informing them of a disclosure about a volunteer that works for the Senior Center who is a relative of Lori Wells, the director of the Senior Center. She is a volunteer for the travel program, and we wanted to formalize that in a written disclosure to our Board Commission on Aging Board, and that was done this week, but I also wanted to inform you that we are disclosing that. At the program, her name is Elizabeth McGurr. She volunteers for the travel programs. It's not exactly a, like a cruise. She actually works and deals with all sorts of issues that come up, problems, questions, emergencies, things that go wrong. We have sent other volunteers. Other seniors have gone on the trips as volunteers, but Betsy is our main trip volunteer. The trips are provided by the travel company, so there's no cost to the county with the exception of a few minor meals that are provided through the Senior Center Network budget. So I just wanted to make you aware of that. We have discussed it in the past at the Commission on Aging Board, but it's been verbal conversations, and so we wanted to formalize it and make it official.
Anyone else wishing to make comment at this time? Okay, thanks.
Sunny, there's one on the ground.
Sir? We can do it either way. You're welcome to speak now, or we can speak to it when we're under that item for discussion on the agenda. Your option. Okay. Anyone else? Moving forward, we have the approval of the agenda. Tom, I believe I got the message that we are pulling the purchase of the vehicles for the Sheriff's Department from the budget,
That's correct.
or from the agenda?
Yeah, the reason being, Mr. Chairman, is that we're looking at a leasing option, which might be a cheaper way to go for us. And so we're exploring that. We'll come back with you on that.
All right, is there any other additions to the agenda? Chris?
I would move to approve the agenda with the exception of the vehicle purchase.
Support?
Motion made and seconded. Those in favor say aye.
Aye.
Motion carried. Moving along, the consent calendar, please, sir.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted receive and file or approval is approved by a single committee action adopting the consent calendar. All information identified on the consent calendar can be viewed in its entirety at www.grandtraverse.org. A. Receive and file. 1. Commission on Aging Monthly Report. 2. Community Corrections Monthly Report.
Are there any items that the public wish to have pulled from the consent calendar? Any item board members wish to pull? I'm going to pull the Commission on Aging report, so we'll have an opportunity if anyone wants to make comment to George's statement. That should have been part of the report, not a public comment. It doesn't give us the opportunity to ask any questions in regard to the statement or the conflict of interest. So I'm going to pull that for that purpose. If I'll receive a motion to approve the consent calendar with the exception of the Commission on Aging, please.
So moved.
Support.
Motion by Kropos, supported by Johnson. Further discussion? Those in favor say aye.
Aye.
Opposed, the same. Motion carried. Okay, special order of business. The historical courthouse clock tower. Who's going to start this discussion? Anyone in particular? Okay. We received copies of a petition from a number of individuals wishing to reduce the hours that the clock tower chimes operate. Currently, they operate from 6 o'clock in the morning till midnight, I believe. And I believe those items, someone is here wishes to make comment to that. This is the opportunity.
My name is Charlie Kern. I live at 283 Midtown Drive, right across the river here. And want to thank everybody for all the work they do for our city and county, first off. Anyway, I'm here just because, I want to compromise on the time. With talking to numerous of my neighbors and people in the neighborhood, and, a lot of them were off the record, didn't want to get involved, but we'd prefer to be like 9 in the morning till 9 at night. For the reason is, I think it's been off for like a decade. Apparently the volume was turned up. I don't know what the decibels are. Do you guys know what it is or went up to?
Not offhand.
It did go up. Someone wanted it up, apparently. But anyway, it's unhealthy physiologically. I mean, there's been studies showing REM sleep, from Sweden. I read some articles, even on the subconscious with that. It's really, in my opinion, an unnecessary noise pollution at night. The bottom line is, I do appreciate the aesthetic value, the historic value that people want. So I don't want to turn it all off, and that it's fine to run during the day is nice. But those of us who live 1 or 2 blocks away, do any of you live downtown, like really close, or?
I'm probably the closest.
Okay. How many blocks do you live close? Or?
I live on the corner of 8th and Oak. I live 0.9 miles from the clock.
But those of us who are right across the river, to me, it's the analogy is I have my grandfather alarm clock right next to my head. I go to bed at like 9:30 at night, then, psychologically, I'm waiting for the 10 rings at 10, then the half-hour one, then the 11 rings at 11, etc. And then if I do get to sleep in on the weekend, I hear it starting up at 6. There's people I know who are grandparents are in the neighborhood, and they said it wakes up their grandkids, parents with their kids, including 2 guys I talked to who live right across the road here. They're guests. It's kind of disturbing. There's 2 guys that work nights. They said I didn't want to use their quotes exactly because it wouldn't be very proper, but they go to sleep 4 or 5 in the morning, and then the clock starts up, and they find it really does not make them very happy. The hotel, I know some people have stayed there, and they said they're not going to stay downtown again because the bell is just like ringing all the time. So anyway, I know a lot of people that live further out. I had to petition people outside the area on the peninsula and other places. Those who aren't living downtown don't care. They don't hear it. They didn't even know it existed, most of them. A lot of people at 10 o'clock at night or 11 or 12 are either finishing eating or leaving the bars. 6 a.m. I ride my bike through there sometimes. There's nothing downtown going on at 6 a.m. Some people are intimidated to talk and sign the petition just because they didn't want to get involved. And there were some kind of nasty things on the Traverse City ticker yesterday. So anyway, my hope would be that we could compromise and just cut it back. So thank you very much for your time, and appreciate it.
Okay. Is there anyone else wishing to comment?
Hello. I know this seems really insignificant to most of you. My name is Linda Cobert, 319 Washington. I also don't want the bell to stop, certainly, but those of us who live so close, after the amplification started, that's when the problem began. When they first redid the bell, it was a beautiful, kind of a muffled sound. It was really lovely. And I happened to know Carol Hale, and she said, "Oh, it's not good enough. I can't hear it from my house." And they went back in and did some amplification so that now, even when our windows are closed, I wake up at 6 a.m. every morning to those bells. So I'd love for it to be, I agree with the man who just spoke. There's no one out at 6 a.m., so except those of us trying to sleep. So it would be really lovely if we could start maybe at 8 when people were starting to come to work, or even with the sound ordinance, which is, I think, 7 to 10 perhaps. I just think some compromise, because at 6 a.m. only those of us in our beds are hearing those bells ring. And now that it's winter and our windows are closed, it is still incredibly loud. And when the windows are open, of course, it's a problem. When I have guests, they ask me how I can sleep. And so I know it's not just me making this up. So when my grandkid came, I put him in an interior room so he could sleep. So anyway, so it's either the amplification that's the issue or the hours. So we sure hope, I know it's really insignificant compared to the other things that you have to work on, but for those of us in the neighborhood, it's important to our daily being. And I live right by the hotel, so I have a lot of noise in my life with trucks and garbage trucks and crashing bottles. So it's not that I'm being precious at all. It's just that every half hour to have that loudest sound coming into the house is really problematic in the early hours and late at night. Thanks.
Anyone else?
Good evening. Thank you for allowing me to speak. I'm Bernie Riker. My wife and I live at 215 Boardman Avenue, just across Washington Street, 3 houses from the bell tower. I beg to differ with the previous speakers. I love the bell tower. I'd like it to go all night long. When we moved to Traverse City a year and a half ago, we chose to live in the downtown area, well knowing that we were going to hear the sounds of urban living. We hear a lot going on. 2 o'clock at night, we hear the young people coming home from the bars downtown yelling and screaming and swearing. We hear the trucks in the morning, the delivery trucks at 4 and 5 o'clock in the morning. So if you're up riding your bike, I'm surprised people don't hear those things, because they do happen. I'm on the committee that helped raise the money to save the bell tower and the bell, And I have no problem compromising it or lowering the tone. I just want to make sure that the record stands straight in what's going on downtown and what the sounds really are. Thank you.
My name is Pete Doran. I live at 408 East State Street with my wife Karen. We're very happy with the current hours of the bell. We have no vested interest in those hours. I think that this is, if there ever was a decision that was an administrative decision and not a legislative decision for the county board, this is it. This is something that your administration should decide after giving an opportunity for everybody's input. I think you may have gotten an email from Ken and Joan Richmond, live right across the street. Very happy with the current hours of the bell. I mean, this is an urban environment. Everybody's got a difference of opinion. Everybody's got a different preference. How do you resolve it? Well, you investigate. You got a legitimate complaint. People are upset about the hours of the bell. Are they justified? Should it be changed? You need to look at it further, but not you, your administration should look at it further and should make a determination as to what's best for the neighborhood, for the other interested individuals. I think it's primarily the neighborhood. There might be other interested persons as well. And I think they ought to be given an opportunity. We wouldn't mind a change. We know that it bothers some people. Some good friends of ours have expressed that it bothers them. Well, let's take a look and see what should be done. The committee, I was on the committee with Bernie and others. The committee was not involved in the setting of the hours. That was Danny Brown, and the administration at that time decided when it would start and when it would end. I thought it was because that's the way it was before. Christine points out, no, it ran 24 hours a day prior to it being silenced when they were worried about the counterweights falling through the ceiling. So, but in any event, I mean, this is a community decision. It's a good process to go through. We think we should go through it. I think it should stay the way it is. If it changes, and that's what the community wants, Karen and I will be very happy.
Okay. Anyone else wishing to make comment?
Thanks a lot, Pete. Thanks, Pete. That's what I need.
Hi, I'm Jane Fulmer, 413 Washington Street, and I did sign the petition, and it's mainly an objection to the early hours. I don't mind it so late at night, but the early hours were problematic. I've gotten used to it, so it doesn't bother me, but when I have guests, it bothers them. And I think in consideration of that and just being a little bit more reasonable on hours, I just don't see a need for it at 6 in the morning, and as long as you're going to adjust that time, I would not see a need for it at 11 at night either. So I would just be happy with any consideration, and I just want to go on record for that. Thank you.
Okay. Anyone else wishing to comment at this time? Bring it back to commissioners. Commissioner comments? Yeah.
Question, maybe someone knows, they're talking about amplification that's been turned up. Is that true? Does anyone know?
I can't answer that.
No.
Without.
Answer that. Joe Murray, Dave Murray is the guy who did it, and he's a friend of mine.
Dave is one of our facilities management employees. Right. Is that who you're referring to?
Yeah.
Okay.
Okay. I guess the comments, and we'll get to everyone here. When we made the decision to have the bell repaired, and Pete and his group raised monies to help fund that, one of the discussions was to try to survey the community to make sure that, the community supported that. And we received a lot of support for having the bell reinstated, and we moved forward with purchasing the electronic chimes to put on the bell. And as far as any discussion, from our perspective, or at least as I recall from the board's perspective, as to what the hours of operation were going to be completely honest with you, I expected when it was reinstalled and was working, it would ring 24 hours, just like the old clock did.
Yeah.
I was surprised to find out, well after the fact, that it was only ringing short periods of time. It was only ringing half of the day. So I was surprised by that. I truly expected when when the chimes were reinstated, that they would be ringing around the clock, like, historic bell towers do. Chris?
The historic courthouse was built, it was finished in approximately 1900. That clock ran 24 hours a day, 7 days a week, until approximately the year 2005. So that's 105 years. And then, again, due to the counterweights and the danger, it was stopped from ringing. A group of citizens got together and raised private funds, and the Biederman Foundation was primary in this fundraising effort, raised funds so that that bell tower could chime again. And the county board said, we will allow the bell tower to chime again if you raise the funds. And they kept their commitment. Now, I live at the corner of 8th and Oak. I would defy anybody to sit outside my front door and find noise any louder than where I sit. I hear the chimes at St. Francis every morning at Mass. I hear the chimes from Trinity Lutheran during chapel, and it's a private school, and they have chapel in the morning. I hear the chimes on the weekends when the service goes. I hear the Thurlby Field noise, the broadcast of the football games. I don't hear the bell tower. That having been said, I did look at the petition. Now, the petition was signed by a resident, and this matters, at 848 Munson, who lives 3.5 miles from the bell tower. Someone on Audubon Drive who lives 6.2 miles from the bell tower. Someone on Barney Road who lives farther out than my sister does, 5.2 miles from the bell tower. Manorwood, 9 miles. Nightingale Lane is in Kingsley. 3rd Street is 1 mile away. I live 0.9 miles away, and I can't hear it. Now, there was a resident at 442 8th, and the morning I received this petition, I happened to be walking because Greg had the car, and I was at a county meeting. So I'm walking back, and I stopped in the middle of the 400 block and 8th Street because I was on my way home. I could not hear the bell tower. Now, I have heard from other residents. I've heard from Bob Otwell, Ed Kalat. We have Ruth Stowe, who is in favor of it. I have heard from more residents in favor of the bell tower than opposed, who live within hearing distance. And please understand, the person who lives 7.7 miles away on North Long Lake Road apparently has sharper hearing than I do, because they're objecting to the bell tower. And I am, quite honestly, I think, and this is just me, I think the bell tower ought to ring 24 hours a day. That having been said, so I agree with Sonny. When we agreed to put the bell tower back, we thought it was going to be a historical ringing like it always had been ringing 24 hours a day. I am perfectly willing to investigate or ask staff, and not Mr. Menzel. I think I would put this on John Syke, the planning director, because Mr. Menzel has his plate full. But I would be perfectly willing to investigate whether we can muffle the sound a little bit. But quite honestly, I'm at the other end of the spectrum. I think that it ought to be restored to where it used to be, 24 hours a day. It's part of living in the city. So there's my 2 cents.
Yeah, I mean, I know it really is, I hate to say it's something that's really not a big deal to the board, in my opinion. I think it's more administrative at this point. I don't care if it rings an hour or 24, personally. I can't hear it in Kingsley. So
Somebody can.
Somebody can, apparently.
Yes, someone on Nightingale Lane.
But, yes, I think it's worthy of going to see if we can do a sound study or something like that. Of course, that's going to cost money, but
Let's just ask John to look into it.
Yeah, for me, I don't think there's anything this board needs to take any action on right now. So.
I guess my suggestion would be just simply ask facility staff to take a look at it and see whether, obviously if the tone can be adjusted up, it can also be adjusted back down.
Exactly.
I don't have any strong feelings one way or the other, but I truly was under the understanding when we reinstated the bell that the bell would ring 24 hours a day. I was completely shocked by the idea that it isn't ringing full time. Carol?
I live in Acme, so I obviously can't hear the bell. But I did spend several years, I lived on Mackinac Island, and the first 2 years I lived there, I worked during the day. And the third year that I worked there, I worked at night, so I slept during the day. And I don't know how many of you have been there, but at 9 o'clock in the morning, they blow reveille. At noon, there is an air raid horn. There is an air raid horn that goes and says that it's noon. The cannons go off. The muskets go off all day. At 5 o'clock, they do something called retreat. And at 9 or 10 at night, they play taps. So when I first got there, the third year that I was there, and was trying to sleep in the morning, it irritated me a little. But then I thought, that is what makes this place. And those are the things that I actually enjoyed about living there. And the chimes of the bell tower in a small town like this, that's part of it, in my opinion. I roll my window down when I know I don't sleep downtown, but I roll my window down when I see that it's almost 5 o'clock and I'm driving downtown. I roll my window down so I can hear it, because I think it's really cool. So that's my 2 cents for whatever it's worth.
Mr. Chairman?
Yes, sir.
I don't have any opinion on the bells, but I'd like to personally thank Pete Doran for his suggestion of making the administrative role, because all I need is another decision that no one will be happy with. So thank you very much for that, Pete. I really appreciate that. But we can investigate it and see if we can do something with the sound and maybe have a compromise. I have nothing as far as bells. 6 o'clock, when I was growing up here, St. Francis, that's when supper was on, and the bells rang, I was home, so that was my calling card. So I have good memories of bells, because I always had a meal with it.
Mr. Chairman?
Yeah.
In the light of the season, I want to just say this. Remember that every time a bell is rung, an angel gets his wings.
Oh, my gosh.
Okay.
Cassius Clay say that?
Lisa?
I'm backing up here.
I don't live in the urban core. I live in Garfield Township, right next to the monastery, and I listen to bells all the time. And the nuns come in and the nuns come out, and it's just kind of part of my life, and all 4 of my babies slept through the monastery, and I'm kind of used to it now after 21 years, so that's not so bad. It was my suggestion to our chairwoman to have John Syke look into this. I know in Garfield we recently had some issues, and what they did was they used their ability to draw from their address list on the tax rolls and send a survey out. And they got their data back within 2 weeks, and they were able to make a recommendation to staff, and I don't believe this is a board matter. And I think that we could probably handle this by, I'll just make a motion to refer this to our planning director, John Syke, to investigate and come up with a suggestion.
I'll support.
I would ask that we include the facilities department in that decision.
Well, I think John will
also,
do that,
because,
all of that. I think he's very capable.
Absolutely. Okay. We have a motion and a second. Is there any further discussion?
There's somebody that would like to make public comment.
Yes, sir. You'll need to come up to the mic, sir, otherwise we can't, the TV can't catch you and the recording won't catch you.
Thank you. Let me speak to you. I understand the petition, it was for people who really didn't care. They don't live down here. We're just asking for a compromise at the edges of the day. If this is ringing at X number of decibels, the government has the right to run the bell. Would I, as a citizen, be able to play my rock music at the same decibel wherever I wanted, in my neighborhood, elsewhere? we got to be careful what we kind of legislate, because then I could do that. We did turn the stands at the Cherry Festival away because the community was complaining, but would I still have the same right to go to the same number of decibels, neighborhoods, play it without any incident, which I don't want to do, but...
I can answer you.
Okay.
The city has a sound ordinance, All you have to do
Right.
is call the city police, and they will come to your residence, and they will measure the sound decibels outside and tell you
Okay.
whether or not anyone is violating that ordinance.
That sounds good. We'll check into the decibels
And you
on
would,
that?
you would have, yes.
Does that
and you
include
would
the trash cans that come at 6:30 in the morning, or?
Call the city.
I don't think so.
Okay, all right, thank you.
I think that John has the ability to rationalize this out and survey who's appropriate, and I think he would do a great job. And I just gave him a job by suggesting that.
Personal growth opportunity.
And yes.
Because I couldn't, in my conscience, I couldn't ask Mr. Menzel.
I'll make
No,
sure I
he's gotta know.
know where it comes from. I'll say, Lisa told you, John.
It was all my fault, but it was out of kindness for you, Tom.
Thank you.
All right, so we have a motion made and seconded. Any further discussion? Those in favor say aye.
Aye.
Opposed, the same. Motion carries.
Thank you
Okay,
again, Pete.
moving forward, items removed from the consent calendar. I pulled the Commission on Aging comment strictly to give us an opportunity if anyone had any comments to the statements that Georgia made under public comment. I guess, at least from my perspective, comments like that should come as part of the Commission on Aging report, not under public comment where the rules do not permit us to have dialogue.
I'll ask John.
I just wanted to let you know, this was brought up at a COA commission meeting, I believe it was Tuesday morning, and when I
John tomorrow.
read the documentation, I made a beeline for Mr. Menzel's office. I let him know. I then contacted Paula Segala because she is our human resources consultant and is aware of county policies. I then picked up the phone and called Chris Forsythe and asked him to talk to Mr. Cooney. So that is why it's not in the report,
Well,
Sonny.
that's fine. I didn't expect it to be necessarily part of the Commission on Aging report, but there was no place else on the agenda to put it. So the easy thing for me to do was to pull the COA report. Chris, do you have any comment about this? Have you had any opportunity to look at this? I know we have certain nepotism requirements or
Right, yeah.
restrictions in our contracts.
As Chris said, she and I did talk. Bob Cooney and I did
Microphone.
talk. Chris Maxbauer and I, we did talk. Bob Cooney and I, we talked, and we're looking into it.
So that should be it.
So, at this point, Georgia, we don't have an answer for you whether we have a problem on it as far as policy. We do have a nepotism clause in pretty much all of our contracts, so that will have to be explored, and we'll get back to you.
There is
in that
no
regard.
contract, Sonny.
This is because it's a volunteer position.
Well, not quite, but let Mr. Forsythe and Mr.
Right.
Cooney do their work.
Exactly.
All right.
Okay,
Okay, thank you.
thank you. We'll entertain a motion to receive and file the Commission on Aging report.
So moved.
Support.
Motion by Max Barr, supported by Kropa. All those in favor say aye.
Aye.
Opposed, the same. Motion carries. Thank you, everyone. Next item would be the Health Department.
I had to get one more immediate approval in for you this year.
And you know how much I love it.
Sorry, this was not my,
They
She
even-
did this especially for you,
They
Sonny.
even highlight them on my tablet now
I cringe
for
when
immediate
staff, no, I
approval,
cringe when staff bring these forward. Wendy Truitt, Health Officer, Grand Traverse County Health Department. We have to bring this forward today because the timeline is running out for us to get this price for this Stericycle. This is a renewal. It's part of a 3-year agreement. We were able to get the price down, but we weren't able to get out of the agreement. We actually had Chris look at it. We were trying to get out of it because the next agenda item is actually a better price that we're using for everything else we need. So this is just for sharps, containers, immunizations, the needles, for the health department clinic services only.
Do we have a motion to approve the Stericycle service agreement for the disposal of sharps for the Health Department?
So moved.
Motion by Johnson, supported by Klaus.
And you, of course, meant
Discussion.
that for immediate approval,
Immediate.
Immediate approval.
because that's what Sonny likes.
Now.
Okay, is there any further discussion? Is this the third year of this contract, Glenwood?
It expires October 31st of 2018, so
Oh, so we're still
it
out
was
there
an,
ways yet.
it was an auto renew clause that happened, we couldn't get
We
out of it.
simply missed it. That's
Well,
unfortunately, those
it
auto
was
renewals.
a former
happen that
employee
way.
who signed off on it, our former finance director, and so it was not in the queue, yeah. But they did drop the price by $31, almost $32 a month.
Okay. Cost of doing business. Roll call vote, please.
Max Bauer?
Yes.
Cropa?
Yes.
Klaus?
Yes.
Crawford?
Yes.
Johnson?
Yes.
Lathrop?
Yes.
Wheelock?
Yes, ma'am. The next item is the Hospital Network Healthcare Services Medical Waste Service.
All right, so this one is for Sharps at the adolescent health clinics, the two of them, and other medical waste that we have from our other clinics that's non-Sharps. It's an estimate of $825 annually because it depends on how many pickups we need. So if clinics get really busy, then we would have more, but we would have the income or the revenue to cover that, so. And as soon as this one expires, if this is still a better price, we will then convert to this one. That's the plan right now.
We have a motion to approve this medical waste services contract.
So moved.
Support.
Motion by Johnson, supported by Cropa. Further discussion? Those in favor say aye.
Aye.
Opposed, the same. Motion carried.
Can I group the next two together?
Sure.
They're identical, just different names. Okay, so these are business associate agreements. It's a requirement under HIPAA once you move to the electronic health records, which we moved to in the last year and a half. This is essentially, we're obligated to obtain assurance when this is how we maintain essentially our database for clients of the information. And this is just the owner of the electronic health record and then the health information exchange, basically saying they're going to comply with HIPAA and keep everything confidential, not release it. And there could be more of these in the future, so I, as a second question, need to know if you want to continue to see these. There's no cost associated, it's just the same agreement with a different group, as we need them.
Pleasure.
I move that we approve the Mitchell McCormick Business Associate Agreement and the Upper Peninsula Health Information Exchange Business Associate Agreement.
Support.
Okay, I have a motion second. Is it this board's opinion that these should come back to us on an individual basis, or can we make this a blanket coverage for HEPA requirements as these individual agreements take place?
Yeah, I'm fine with that.
You're okay with that, Chris?
Yep.
Will the motion in the second approve that?
Yes.
Sure.
So you'll have to figure out how to word that, Sarah, but, you know, I'm sure you can handle
Thumbs up
that.
from
I got
Sarah.
this.
It's just, there's probably no reason for us to handle each one of these individually.
If we get something out of the ordinary, which we shouldn't, because we generate these, but if,
Right.
We always-
Well, and,
we
you know,
always
we're-
have it
we
go through the
We have
lawyer
all these
anyway.
records, and as we continue to move more and more information electronically, there's certain agreements that have to go in place with it. And, you know, I've said before, HEPA is the worst thing that ever happened to medicine anyway, so.
I mean, is this even something that needs to come before us and the
Well,
administrator can do it?
well, if we pass this motion, then from now on, they won't come to us. The health department will just sign off.
I didn't know the P stands for portability. I was wondering. You don't even look anymore. You get them every time you go to the doctor's.
Yep.
Yeah,
Exactly.
just sign.
Yep.
You say HIPAA an awful lot, but you don't really know what it, you know.
Okay, we have a motion made and seconded. Further
But
discussion?
I was
Tom?
just going to say, building on Commissioner Johnson's comments, Chris and I were just talking, is a lot of these things don't need to come here. They make these meetings long. We're going to work on a different process because it just doesn't make any
Good.
sense, so. But we'll get to that.
I don't think
Premium
any-
Wednesday.
I don't think any of us,
There you
I don't think
go.
any of us will object to that.
Yeah. I
Okay,
just-
we have a motion made and seconded. All those in favor say aye.
Aye.
Opposed, the same. Motion carried. So you will just handle those administratively from your department, please, Wendy. Sheriff's Office vehicle purchases was pulled from the agenda. We have no unfinished business. We're not showing any new business. Is there any items that I am not aware of? Seeing none, this will bring us to the second opportunity for public comment. Is there anyone wishing to make comment at this time?
Geraldine Green, 214 East 11th Street. And I know the county commission is looking at every way possible that they can cut the budget to cut the multi-million-dollar deficit that you are in. And I would recommend that you look at your own wages. Just sitting here figuring in my head, you make more a year than someone working at minimum wage, 40 hours a week, makes in the city, in the county of Grand Traverse. So, if you want to find other ways, take your basic wage and be happy with that. You don't have to charge the taxpayers $20 or $30, whatever it is you get, for every little meeting you go to. It would maybe only amount to $100,000 a year savings, but you're looking at $100,000 here, $100,000 there, and this is another way that you could do it. So, thank you.
Anyone else wishing to make comment? We'll close public comment. Commissioner committee reports. Lisa?
First question would be, in looking at streamlining some of the things that comes to meetings, the Sheriff's Department vehicle purchases, we brought that up several times. Maybe if, when you're discussing about the other things, these vehicle purchases are in the budget, yet we have to do that. The next thing would be just doing elementary school math. If you were to calculate minimum wage and lower it to $8 an hour, times 40 hours a week, times 52 weeks a year is $16,640. Nobody sitting on this commission makes that a year. So I just want to make that clear for the record.
You're wrong.
Excuse me, we're...
The record Eagle has shown that some of you make $19,000 by the time you collect everything.
We're not going to have a dialogue here, so we're just moving forward. Other commissioners having comment?
I'm good.
Seeing none.
I would like to ask our finance director to publish for the record the salaries of the commissioners. And you will see that not one commissioner
That number
makes
has been published on multiple
and not
occasions.
one commissioner makes $16,640 a year. Dean, can you say that that's correct?
Not without looking at the numbers, he won't.
Well, your base salaries are definitely less than, lower than that. They're either 8,000 for the chair, 75 for the vice chair, and 7,000. But there are the per diem, but I doubt that most of you are over that when you add the per diem in, but without looking, I don't know, but I don't think you're over that.
No,
I can safely tell you that my W-2 form from the Grand Traverse County will be right in the neighborhood of about $10,000 this year.
And we did have it published 3 times last year.
18 years. So.
The highest salary was a little under $15,000 last year, which is less than minimum wage at 40 hours a week, times 52 weeks a year.
Let's move forward. We would like to take this opportunity to congratulate Jason Torrey on being appointed the Director of Central Dispatch. Jason's done a great job for us for a number of years, and I think all of us in this room certainly appreciate his efforts. He's really stepped to the plate over the last 8 months, and at least from my perspective and my recommendations and comments that I made to
Well, shortly
Mr.
after your
Menzel,
recommendation, Tom took it.
It didn't take brain science to figure out who should be named the emergency service or emergency dispatch director. So I do want to congratulate Jason publicly and acknowledge his efforts. Okay, we have no need for closed session.
I think Dan has a comment.
Dan?
One announcement. I did congratulate Jason today for his promotion. I wanted to announce that I did speak to a group of veterans at the American Legion Hall, I think it was Monday night, about Colonel Demis T. Craw. He's our Medal of Honor recipient in Grand Traverse County, the only one. And I'm promoting, my mission is by next Veterans Day to have our new clinic named after him. So I'm just reminding you that I'm doing that, and I'm trying to build a groundswell. It takes an act of Congress. So we're going to try to get an act of Congress to happen. And I might be asking this board to maybe sign a resolution in favor of that. So, giving you a heads up.
Okay. Anything else from commissioners? Tom?
Just one last thing, I'll be on the Ron Jolly show tomorrow at 9:10, just talking about general issues in the county, and Dean and I did the afternoon drive yesterday, and he was a real star. They're probably going to ask him back. He said he hadn't done one before, but we had a lot of fun. He did a great job.
He's actually smiling.
It was a lot of, he did a good job. It was a lot of fun, so we enjoyed that. And as I said, we all know Dean's leaving, but I really appreciate the way he's helping out, and he couldn't be more gracious with his time. And I told him that I'm hoping that once he decides what he wants to do and recharges the batteries, that maybe we could work on some. There's some projects I have in mind I'd like to have him back and work maybe jointly on. So he may stay involved. He has a wonderful sense of history, and so I'm hoping that we can still keep him involved to some extent.
Okay. If we have no further business, we will stand adjourned. Thank you, everyone.
There you go.
Come with me.
I will.